So this is your demonstration for your canine palpation video. So we're going to go through step by step the muscles that are in your video and show how you should palpate them for your exams. And then obviously going through origin and insertion and how you palpate them from origin to insertion. So the first one on your table is the masseter muscle. So this comes from the zygomatic arch and inserts onto the mesenteric fossa of the mandible. The action of this muscle is to raise the mandible, so it opens and closes the jaw, helps with that. The next muscle that we've got on the chart is the trapezius muscle. So this comes from the dorsal median raphe of the neck. Then for the next part, you want to palpate down till you find the third cervical vertebrae. So we need to actively see you go down from the top all the way down to the third cervical. And then it goes down the spinous processes of the thoracic vertebrae 1 to 9. So you want to start between the middle of the scapula and then go all the way down, palpating the tops of the spinous processes 1 to 9. So you can see here, Helen's going down and just feeling the tops of all the spinous processes of the vertebrae. She needs to come back to number 9 of the thoracics. Then it inserts, so the cervical portion goes onto the dorsal 2/3 of the scapula. So it's coming down from the cervical region into that dorsal 2/3, and then we've got the thoracic part that inserts onto the dorsal third of the scapula. So it's obviously coming from the caudal part near the ribs and going in through onto the top of the scapula. The action of this muscle is to draw the scapula dorsally, so it's going to pull up the scapula. The cervical portion is going to bring this scapula craniodorsally, and then the thoracic part is going to move the scapula chordodorsally. The next muscle is cleidocervicalis, so that's the dorsal median raphe of the neck. So this one is cranial to the trapezius, and then it inserts down onto the clavicular intersection, so that's that muscular band in the middle part of the neck. And the function of this muscle is it draws the thoracic limb forwards. So it's going to aid in protraction of the limb. The next muscle is sternocephalicus. So this comes from the first sternum or the manubrium, so right at the front. And it goes up towards the masseter process of the temporal bone and the nuchal crest of the occipital bone. So it's going all the way up. And what this muscle does is when one side's acting, it's going to, it draws the head ventrally, so it's going to bring the head down towards the chest. And then when one side is acting, it's going to move the head to that side. And then also what it helps to do is also do forelimb protraction. The next muscle is brachiocephalicus. So that comes from the distal third of the humerus on the cranial border. And then it goes up on the cranial, so that the cranial lateral border of the shoulder, and splits into two parts. One part goes onto the nuchal crest of the occipital bone, and the other part goes up onto the masseter process. So just like Helen's doing there, you'd palpate both insertion points. And again, this one helps to bring the limb forwards. And then it also helps to bring the head to one side when one side is acting. So it's going to help with the head to bend to one side. The next muscle is omotransversarius. So that comes from the acromion of the scapula. So you need to find your point of the acromion at the base of the scapula. And then that inserts onto the wing of the atlas. So you're going to go up and palpate the wing either side of the back of the neck. And again, this muscle helps to bring the leg forwards. And then when one side is acting, it will draw the head to that side, so it'll help bend the head round. The next muscle is deltoideus. So this comes from the spine of the scapula and the acromion. So we want to see you palpate the spine of your scapula and the acromion. And then it's going to insert down onto the deltoid tuberosity. So this is that tiny little bump that you feel on the cranial aspect of the humerus, about a third of the way down. That's a flexor of the shoulder, so it comes sort of quite caudally when you're looking at the limb from the side, and then what that's going to do is help to flex the shoulder, just like that. The next muscle is the brachialis, so that comes from the lateral supracondylar crest, so down near the elbow, and then it wraps around and goes on to the distal medial radius. So you just kind of want to go down sort of distally and then just remain medially, okay? That muscle is a flexor of the elbow, so that's going to aid in elbow flexion when it contracts. The next muscles are the pectorals, so we've got two sets here. So first of all, we're going to do the deep pectoral. So that comes from the body of the sternum and inserts onto the greater and lesser tubercles of the humerus. So it's coming up underneath at the front and then inserting onto the greater and lesser tubercles. What this does is obviously to help support the trunk. So obviously helps to keep the leg attached to the body. And then what it also does is it's a retractor of the forelimb, so it helps to bring the limb backwards and also fixes the shoulder. The next muscle is the superficial pectorals. So this goes from the manubrium and the cranial part of the sternum and inserts onto the greater crest of the tubercle. And again, this is trunk limb attachment, so it's going to help to attach the limb to the trunk. And what this does is it's an abductor, so it brings the limb into the midline. So it would help with that, and then it protracts as well, so it helps to bring the limb forwards, and is also a retractor as well, so it helps to bring the leg backwards as well. So it does retraction and protraction. So the next muscle so at the minute we're doing obviously the sort of the cervical neck region and the forearm. So the next one is the rhomboids. So this is made up of a capitis, cervical and thoracic part. So the capital part comes from the nuchal crest. Then the cervical part comes from the dorsal median raphe of the neck, from the second cervical vertebrae to the first. So we know that we can find our first thoracic vertebrae will be down in between the shoulder blades. So we want to see you palpate all the way down to the first thoracic. And then the thoracic part is just basically the cranial thoracic spine. So that's going to be your first couple of ones. And then what they do is they insert onto the medial surface of the scapula. Obviously you can't palpate this, but you're just going to indicate to the examiner that obviously it would run medially, so you would just kind of show where it would insert. This one just helps to fixate the limb. It also elevates the scapula, so it's going to help lift the scapula upwards. And then it also helps to draw the scapula forwards. So that would be when your capitis and your cervical part are in contracture. The next muscle is the teres major and minor. So we're going to do teres major first. So that's the caudal margin of the scapula. And then it inserts down onto the teres major tuberosity. So it's coming in behind the back of the humerus. And what that does is it flexes the shoulder. Then the next one is obviously teres minor, so that's the infraglenoid tubercle, so you're going more on your humerus now. And the distal infraspinatus fossa, so that's obviously going to be on your scapula as well. So you want to be palpating the distal end of the scapula and then finding your infraglenoid tubercle as well on your humerus. And then it inserts down onto the infraspinatus muscle surface of the humerus. So basically this is just where the infraspinatus muscle inserts onto the humerus. It's a flexor of the shoulder, but it also helps with taking the forelimb away from the midline. So it's going to help with abduction, so it's going to help to take the limb away. Then the next muscle is serratus ventralis. So again, this is broken up into a cervical and a thoracic portion. So the cervical part comes from the transverse processes, the 2nd to the 7th. So you want to make sure you're making it very clear to the examiner you're palpating from the 2nd all the way down to the 7th, which will just be in front of the shoulder blades. And then with the cervical part, you're going to count ribs 1 to 7 back. So you're going to find your ribs on the lateral aspect of the dog, and then you're going to palpate back 7 ribs. Then this inserts onto the facies serrata of the scapula. Again, obviously this is a medial attachment, so we're not expecting you to obviously be able to do that, so you're just going to indicate to the examiner where that would be. So basically it's just one of the most important muscles at supporting the trunk and helps to raise the neck as well. So obviously when the cervical portion contracts, it's going to help with head elevation. The next muscle is sternomastoideus. So this comes from the clavicular intersection and also the manubrium of the sternum. So you want to be palpating that cranial part of the sternum and then the clavicular intersection, which is sort of halfway up the neck. And that inserts onto the masetoid process of the temporal and the nuchal crest. And this is a protractor of the forelimb, and also helps to draw the head ventrally. So it's going to obviously help to bring the head down towards the sternum, and then also when it's one side's contracting, it will move the head to that side as well. The next muscle is tensor fasciae antebrachii. So this comes from the caudal margin of the scapula and inserts down onto the olecranon. And the antebrachial fascia, which will just be around that region, that will be the fascia around the cranial aspect of the forearm. And then what that does is it extends the elbow, so it's going to help with elbow extension. So it's going to help to take that elbow out into extension. And then what it does as well is it tenses the forearm fascia, but the clue's in the title there. Then the next muscle is the triceps. So we've got the long, lateral, medial and accessory. So we'll do the origins in first for all of these. So the long comes from the caudal margin of the scapula. Then the lateral comes from the proximal lateral humerus. Then the medial head will come from the medial side of the humerus. So this is going to be more on the inside. And then the accessory comes from the caudal neck of the humerus. So that's going to be the most distal one, caudal one, sorry. And then it inserts down onto the olecranon. So it's an extensor of the elbow. So it's going to help to extend the elbow. And then the long head, and it's only the long head, will do shoulder flexion as well. So it will help to bring the shoulder up into flexion, but that is the only one. The other heads don't do that. So it's only the long head that flexes the shoulder. Then we've got biceps brachii. So that comes from the supraglenoid tubercle of the scapula. So that's coming down almost near to your humerus. and inserts onto the radial tuberosity and the proximal medial ulna. So you're going all the way down now. So this is the one that obviously runs over the front of the elbow joint. And when this contracts, what it does is it flexes the elbow. So it helps to close the elbow joint in contracture. But if you think about it, that should be quite logical. It's running down the front of the elbow. So as that contracts, it helps with elbow flexion. The next one is latissimus dorsi. So that comes from the thoracolumbar fascia, so all the way back. So from the lumbar region and the thoracic region, and then inserts onto teres major, so the caudal part of the humerus. So it's going to come in, as Helen's shown there, like a triangle shape, and inserts onto the teres major. That one obviously helps to draw the limb caudally, and as in doing that, so obviously retracting the limb, it's also going to flex the shoulder as well. Then we've got subscapularis. So that comes from the subscapular fossa, which is obviously going to be on the medial side of the shoulder. And then inserts onto the lesser tubercle of the humerus. So again, that's going to be more medially. So you're just going to identify, to show the examiner that you know that it's medially. And that is a very good muscle for abduction of the shoulder. So it's going to help bring the limb into the midline. So that's all your muscles of the cervical neck and then the forelimb. So the next video will be the muscles of the distal forelimb.